Study for the MCAT anytime, anywhere, and boost your score. Get started with the MCAT Prep app by Med School Coach. Access hundreds of video tutorials, flashcards, and a robust question bank. With study scheduling and spaced repetition flashcards, mastering the MCAT has never been easier or more convenient. Join thousands of satisfied users who have elevated their MCAT game. Download the MCAT Prep app by Med School Coach from your favorite app store today.
How about connecting people and making them feel dignity and making them feel cared for? I can't imagine the damage it does to a person knowing that their life doesn't matter. That's what leads to economic disparity, leads to global conflict, war, death. Let's change that conversation.
Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Join us weekly for stories and insights to empower pre-med and medical students to pursue their aspirations of becoming doctors. Hear from physicians, deans, advisors, and industry experts on becoming a standout candidate and what life is truly like in the medical field. Let passion ignite your journey toward residency and becoming a doctor.
Today, I think we're going to dive a little more deeply into some of the cool things you're doing. Yes, you are an emergency medicine physician, but as we've heard, like with your REAPs, you have a close heart to health equity and global health. So we'll talk about that and just see how you're working in that innovative space. So as you mentioned, you're the CEO of Healthcare Alliance for an Equitable World. Can you tell us a little bit about that and its mission and services?
Sure. Oh boy. So it certainly is not something I could have done 50 years ago, right? That 50 years of life experience led to the Healthcare Alliance for an Equitable World. But as an emergency physician, I've been living at the intersection of where healthcare and the environment and the society and politics and economics all converge. I'm so proud that our specialty is the safety net for any and all people and that no patients are ever turned away. And because we live in that space, often we are faced with trying to figure out how to help people when their needs are more than just a prescription or a test. And often that's everything, right? That's a lot of what people need. So I've lived a life and a career where I've tried to do that within the institutions that exist. I've become a leader within the institutions that exist, Deputy Chief of Emergency Medicine, and then a director, tele-emergency care, and really trying to see if can we create change from within. And I'm never want to be a pessimist, but the arc of change is slow when institutions are entrenched with systemic bias, systemic exploitation of others. And so I came to a place where I'm like, who am I waiting for to fix these issues? Let me do the work I can do to learn how to be a business leader, how to be a leader, how to make the organization of the future. What do I want the organization of the future to look like? And if I know all those things, then it's incumbent upon me to just create it. Why don't I just create it? And that's how the Healthcare Alliance for an Equitable World started. It is a global telehealth company with a mission to, in our lifetime, for real and legit in a few years, to bridge the global healthcare workforce gap by using telehealth and using the healthcare workforce we have today. 15 million healthcare workers are a deficit globally. 15 million. We only have 13 million doctors. So we have to double the healthcare workforce to bridge this gap. How long is that going to take? Generations. And what about all the potential, all the lives that are waiting for that care now? I'll tell you one thing I learned is I know our community. Our community wants to make a difference. Our community cares deeply. And our community is not happy with just being transactional agents for money for healthcare. So I made the leap to say, I am going to try to connect not just a physician community, but lots of global healthcare leaders. I'm going to create the community that can work together to create this change today. And if we can get just 1% of those 13 million doctors to work 2 hours in a whole year in telehealth, we would have 700 hours of physicians a day, or 29 physicians every hour, to provide healthcare to the people that need it the most in low and middle income countries.
And how are you working to gain people to kind of join the initiative?
So that's the part where you have to learn a little bit about business and about everything, right? Erkeda, I'm sure you know this. You have to be visible. You have to share your mission and your voice. And that's super vulnerable. I think as a physician community, we're generally taught, and we get this message, to stay in our lane, that everything outside of sitting at the bedside and providing care is somehow not in our lane. So we hide our voice and we hide our ideas. And I think the time is perfect. We are at a crucial time in history, in the history of medicine, where healthcare workers have seen and experienced that it's time for them to take ownership and to drive the bus to the destination we want to go to.
I love that. And you bring up a great point, because a lot of our listeners are at the point where they're considering going into medical school, especially like after the start of the pandemic. A lot of people have seen all the horror stories. There's been a mass exodus of physicians. There have been conversations about other specialties who are definitely valued members of the team kind of encroaching on some of the things that physicians do and all of the things. So a lot of times it may be a little discouraging to go into medicine. And then when you get in there, for those who are in school, you are dead set on going into a specific specialty or doing this for 30 years, all of the different things. And you may have these naysayers, like kind of saying like what you said, like stay in your lane, like figure out what you're going to do. I can recall working as an attending with one job, and I'm not going to get too far into myself because it's about you today, but I had signed up for an enrichment CME. So for those who are listening, doctors have to do continuing medical education because it's a continuous learning experience. It doesn't matter if you finish all of your boards. So I signed up on one on like physician growth type things, mindsets, all of that stuff. And my supervisor denied it. They denied paying for it because she said that I needed to do something within my specialty, and I'm a doctor and I only need to learn about doctor things. And that was so offensive to me. It actually signaled me that it may be time to leave that organization. But a lot of people get to that time and that place. So it's great that you are talking about how we can kind of redefine it and do what we want in medicine and what we envision, and impact those communities that need it.
Absolutely. And people will try to separate us and put us into our little silos, right? Because when you do things in community, it's way more powerful than trying to be the lone voice. I think a lot of what's happening now around physician burnout, look, it's people are in pain. They have been betrayed. They have been shown very clearly how they are not valued and how the patients aren't valued and how they are just a part of the machine. And I have complete grace for whatever people decide to do with that, right? You feel you need to pull out of medicine because you don't see another way. That's okay. I'm not here to judge anybody. I am here to create an alternative. I believe that what we were doing is going to connect us in a way globally that we've never been connected before, that we have been told and prevented from connecting in the past. I think going and doing this work internationally and seeing how people live, what the needs are, how healthcare is carried out, and being part of conversations with all kinds of healthcare workers all over the globe will change that dynamic for us in a way that has not occurred in the past. I think we can get those people that have left medicine to come back and do this kind of work. You can sit at home and do this work, but you need to bring a couple things. You need to bring humility. You need to bring curiosity. You need to bring a learning and coaching mindset and a respect for other cultures, but you get so much more. Oh man, you get that joy, that excitement. I remember learning about the human body when you come from zero to medical school and you're like, what a privilege. I get to know this stuff that nobody in my family, I'm an immigrant kid, the first to go to college, knows, right? And we lose track of that in the system where like it just becomes regular. Like I go to work and I save lives every single time I go to work and I just blow it off like nothing. I think this brings us back to a place of curiosity, learning, community, and growth that is going to make our community stronger than it ever was before, at the same time as making healthcare the basic human right that it needs to be. Because there's potential being lost every single day by people not being treated for medical care. There's genius out there in poor communities that needs to be given a voice and uplifted by having something as simple as medical care.
Absolutely. I couldn't agree more. And you brought up a great point in terms of like the awe and the spectacle of medicine. A lot of us are so excited. Like when you go to your first anatomy class, like you have the gift of learning, like someone gave their body, for those who may have not done anatomy yet, someone like gifts their body for you to learn how to practice medicine, for you to learn all of the body parts, all of the things. And when you start seeing patients, yes, you will have a lot of firsts. You are, like I like to say, doctors are more intimate than intimate partners with individuals because you're there when you're birthing the baby, you're giving them good news, you're giving them bad news. You are there when people take their last breath. So you can hold people's hands and you should never get to the point when you're doing that where it feels like, oh, just another person passed away. I had 3 of those today in the ER, or oh, it was just another baby or something like that. When it gets to that point, you may have some signs of burnout, but you will lose that sense of kind of mysticism and excitement as you're doing it day in and day out. So I love that you are able to utilize your organization to not only bring that wonder and that joy back to people who may have lost it, but also to contribute globally to so many people who need it. What you said, the deficit. I honestly didn't know we were in a 15 million doctor deficit. I know that there are 1 million doctors in America and we are very in need of creating more, especially in rural and underserved communities. But just thinking from a larger, grander scale, there are so many people who are in need and we have the knowledge and the resources to help.
That's right.
In the competitive world of medical school, your application is the first look advisors have into what makes you shine. But where do you start? Luckily, Med School Coach has the expertise to elevate your application to the next level. From crafting a compelling personal statement to developing a narrative for your secondary essays, we know what admissions committees are looking for, and we're here to help you develop your authentic voice. Visit medschoolcoach.com for more on application support.
So 75% of the healthcare is taking place in 22% of the global population. It's happening in North America, Europe, Australia, and some of South America. So most of the healthcare is concentrated there. And look, we have inequities here, even within the United States. So much about all of history is exploitative, right? So all the healthcare is not just concentrated in rich countries, it's concentrated in little subsections of rich countries. And we tend to create more and more innovation that makes that little pocket of care even more specialized. We're like, let's make it even more special and make it even more narrow and more narrow. And that's a hierarchy of society that's probably outside the scope of what we can talk about in this podcast. But I know healthcare and I know the people in healthcare. And I'm mostly talking to doctors, but I've worked with nurses my whole life, nurse practitioners, PAs. We're a community. And all of these divisions are ways to keep us separated and make us infight, right? Because when you infight, you have no power. When you unite, you have a lot of power. And, this whole thing about burnout, all of a sudden it's the problem of the healthcare worker. It's the silence, the rage, and the voices that are saying, we're not burnt out. Healthcare is burning down. We just have to look. You're in pain. You need to do what you need to do. And I support that 100%. And self-efficacy and self-empowerment is super important. But we can make systemic changes, and we don't always have to do it just in the box that we're in.
I agree. In speaking outside of the box, you're innovating in the telehealth space. Can you share some kind of insights on how this is helping globally and how we're kind of pushing the frontier there? Because a lot of times we'll hear about, yes, we're incorporating some digital health startups here in the U.S., or yes, hospital systems are creating telehealth systems. And when you think about it, in some systems, like me specifically working in digital health as a digital risk management consultant, a lot of times doing what we did in person, just online, the way we need to innovate when we're thinking about that. So what are your thoughts?
So what I don't want people to say is digital health, telehealth is replacing in-person medicine. That is definitely not the purpose. If you have high-quality in-person medicine, you have all the access you need. Woohoo! Let's keep going. What digital health is, at least in the version that I'm developing, what it does is it lets us use the expertise that we have taken decades to grow. To create a doctor, it takes decades of higher education. It's taking the expertise we already have and amplifying it to reach more people. Global health has been limited for years because it's limited to a few people being able to leave their homes, have no child care needs, no family care needs, no need to make an income and go travel somewhere and for a short period of time, do something for a community, maybe a month, and then come away. That's been the story of global health in the past. So that limits who can do it. And then it has an impact on the communities where it's just kind of people dropping in and dropping out, and it doesn't improve the healthcare infrastructure for the community. We want to change that conversation and say, we'll take the communities we have now all over the world, all these trained healthcare workers, and we'll make them accessible to a community on an ongoing basis. Let's integrate them into a healthcare system that's struggling. You have half as many doctors as you need. Let's support you and bring that up to 75, 80, ideally 100%, right? And at the same time, we're providing peer support, education, and we're growing your healthcare system. Is it okay if you don't need us one day? Yeah. I wish this would grow so fast that in my lifetime we would be obsolete, but I don't think that's going to happen. But I do think it's going to change the way all of us practice medicine. This is the future. I'm not looking back. I'm not a look back kind of person. Your audience that's listening, medical students and residents, this is going to be part of their life. This is going to be part of how they practice medicine. I'm shocked that they're not getting exposed to it yet. I'm going to offer them that opportunity. They should be exposed to it right now. They should know what it's like to have a global lens on healthcare, right? Because then they can build more equitable systems right here in the U.S., and they should know how telehealth can help expand their impact to more people. Even when I practice telehealth here in the United States, there's tons of people that don't have transportation, that live in rural areas, that can't afford to just go drive to a hospital 4 hours away, wait 4 hours. I mean, it's a whole day trip. Again, you have to have all kinds of things in place to do that, all kinds of privilege. You have to have nobody you need to take care of at home. You have to have transportation. You have to have money, and you have to have time. We have this thing, we're literally doing it right now as we shape this podcast. We are connected to everybody globally now, and we can use that to amplify what our touch, increase how many people can do this global health work. Imagine everybody now. If this was every medical student did a global health telehealth rotation, how would that change medicine?
Change it completely. It would even change their perspectives, like even what you said. Well, you're an emergency physician. I'm a family physician. We see the gaps where, for instance, I had a patient when I was working in person when I worked at a federally qualified health center who he was undocumented, lovely gentleman, ended up developing kidney disease, ended up getting really bad with it and needed to go and see a renal doctor. The renal doctor recommended that he get dialysis.
Can't get it.
Dialysis center would not accept him because he doesn't have insurance. So the fix was to go to the emergency ER. Like, how is that fixing?
Yes, we saw those people all the time.
How is it fixing it? So we have to do better.
We have to do better.
Yeah.
That's right. Erkeda, I've seen that. Yes, absolutely. We have to do better. But anyway, I'm creating a vehicle for that, a vehicle to help people all over the world and a vehicle to create the community and the change and like an accelerated path to that. You know, we can do this in a short period of time. I have a 1% goal to get 1%, 130,000 of those 13 million those 13 million doctors. There's twice as many nurses and midwives and dentists and therapists. I mean, these are all types of medical care that are highly unavailable in the 78% of the people in the world. You want to talk about how do you change a world that's always in conflict? How about connecting people and making them feel dignity and making them feel cared for? I can't imagine the damage it does to a person knowing that their life doesn't matter. That's what leads to economic disparity, leads to global conflict, war, death. Let's change that conversation.
Can't wait for us to change the conversation. And as we come to a close, you mentioned that we're working to bring people on and to have eventually rotations where students and residents can kind of get the experience and be able to know it before they go out into the real world. Are you offering these now? And if you aren't, when will they be available?
So if you have students and residents listening now, and they can talk to their leaders at their residency or their medical school, we could absolutely offer this now. We are in the process of supporting 2 rural hospitals, one each in Kenya and Uganda, associated with 2 boarding schools in both of those locations, 2 Maasai clinics, and a total of 7 rural clinics. Mm-hmm. And I have lots of experience in residency education. I have been a residency program director, and we can create a curriculum and we can have these young people doing this now.
I can't wait to hear more about that. And hopefully once some of your students come rotating through, they can come and share their experiences on here. So I definitely...
I want their ideas.
Yes.
I want their ideas. I want them to say, okay, I like what you got here. Here's more.
Where?
I want because this is their world too.
I love it. So hopefully you guys have taken something from this. I think that this new program, this new way of reaching out to not only impact people locally but globally with such a great physician and clinician workforce shortage is so important. So for everyone who's listening, I just ask that you share this with your friends, share this with your leadership at your school or your institution or your residency director, and see if there's any kind of synergy there. I also would ask that you guys send us some suggestions for any more conversations that you want to have on this. And with that, I'll just give you an opportunity to tell our listeners goodbye and how they can reach out to you.
Oh, that's wonderful. Erkeda, it has been such a pleasure to chat with you. You're an amazing host. We've just met, but I feel so warm and welcomed, and what a great interview. To your audience, we can be reached at our website, https://HAEW for Healthcare Alliance for an Equitable World.org. And for direct email, info, at haew.org. Also, we have a YouTube channel at Kim Tranquada MD with lots of videos about what we do in our project. And also the Voices of Healthcare Equity podcast available on Apple and Spotify, where I have conversations with people doing global health all over the world and just kind of exploring these conversations.
If you like this episode, please share it and make sure to subscribe anywhere you get your podcasts. You can also find me, Dr. Erkeda DeRouen, on Instagram at Dr. DGram, DOCTOR, the letter DGRAM, or on LinkedIn under my name, Erkeda DeRouen. See you guys next week.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.
Are you ready to conquer the MCAT and secure your future in medicine? Look no further than Med School Coach. With our unparalleled expertise and cutting-edge resources, you'll tackle the MCAT with confidence. Our practice exams, crafted by the world's leading MCAT experts, provide the most realistic simulation available. Discover your strengths and weaknesses with in-depth analytics and detailed explanations for every question. Plus, with options like our free half-length exam and affordable bundles, mastering the MCAT has never been easier or more accessible. Don't just prepare for the MCAT, excel with Med School Coach.